What is up, everyone? Welcome back to the channel. I'm officially halfway done with my core clerkships. It's pretty wild. I can't believe how fast these past 6 months have gone by. Last week I finished up family medicine, took my shelf on Friday, and then had a nice 3-day weekend because it was Memorial Day. It was really nice how everything worked out to where everyone finished their rotation right before a 3-day weekend, so we had an extra day to just relax and breathe. I didn't do anything too crazy. I went to the beach one day for a few hours because it was really nice, and then other than that I just kind of relaxed. So earlier today, Tuesday, we had an orientation. So we had a virtual session from 9 to 12, just going over the basics of the clerkship. We also had a 1-hour neuroradiology session mixed in there, so that was a nice refresher on some stuff that I kind of forgot from preclinical. And then after the virtual orientation, everyone went to their actual clinical sites. So I went to the hospital that I'm stationed at. It's gonna be a bit of a longer drive than I have been doing. I thankfully have been super close to the hospitals that I've been stationed at for the first half of clerkships, but like a 30-40 minute drive from this next hospital, so that'll be something to get used to. I had a really good experience on the site visit. Everyone I met was so nice, like the administrative people. The one doctor who's kind of in charge of us is great. This site has a lot of residents there, which the other sites for neurology at my school actually don't have any residents, so that's also really nice because residents generally have a little bit more time than the attendings to do some more one-on-one teaching and stuff, and just generally more approachable because they're also sort of in training. There's a whole neuroscience center at the hospital that I'm at, so everything is just kind of contained in this one area of the hospital. In terms of the structure of the rotation, it's only 6 weeks long. One of the weeks, which I'm on right now, we have like a subspecialty clinic week where every day you're in a different subspecialty of neurology. Unfortunately, the way that my schedule worked out is, since this is the first week of clerkship and Monday was Memorial Day, I kind of miss out on 2 of the days of that. But some of the subspecialties that you can work in, I know most people have a day of pediatric neurology, also movement disorder clinics, so like Parkinson's, Huntington's, that kind of stuff. I think there's a headache specialist that you can work with, and they'll do like Botox injections for migraines, so I'm sure that's a cool experience. If this was a normal week for me and I had all 5 days, I would have 3 days of the clinic and then 2 ED shifts. The ED clerkship at my school is a little weird. It's like longitudinal, so you have 2 shifts in every single block. And the way that they schedule it for neuro is you have both your shifts during this week. So that's actually what I have these next few days. Wednesday and Thursday are my ED shifts. So I'm really not starting neurology yet. It's just kind of what I've been doing. And then right now I have a movement disorder clinic scheduled for Friday. However, during the orientation, our clerkship director was saying, if you have any special interests, we'll try to sort of accommodate that with a few of your days for your specialty week. So if you're interested in ophthalmology, you can work with a neuro-ophthalmologist. If you're interested in surgery, maybe you can work with a neurosurgeon. So I did reach out to the coordinator, and I'm going to try to get in with a neurosurgeon on Friday, just because I think that'll be a really great experience. We don't really have any exposure to neurosurgery during our core rotation, so hopefully that works out, but I'm not really sure right now. So aside from that week, I'll just kind of go through the rest of the weeks of my rotation. So another week we have is epilepsy. So you get a whole week on the epilepsy service. I'm not really sure if it's primarily inpatient or outpatient, and then after that I'll be with the stroke team. So that's mostly inpatient. Then after that I just have normal general neurology on the ward. So pretty much any patient that's admitted to the hospital and you need neuro consulted, that team will round on them. And then my 5th week is actually PM&R. So that's one really cool thing about the neurology rotation is everyone has to do a PM&R week. We have a really good program at the hospital that I'm scheduled at. PM&R has always been something that I think that I might be interested in, just because I like the musculoskeletal system, nerves, that kind of stuff. So I'm excited to see what they actually do. And then my last week is actually going to be in the neurocritical care unit, which will, on one hand be a great experience. I'm sure I'll learn so much, but kind of rough to have it my last week just because it is probably the most intense thing that we do in our neuro rotation, and having to do that right before I'm doing my exams might be tough. But yeah, all in all, I think it's going to be a really good clerkship. Alright, it is Thursday. I just got done with my second ER shift in the past 2 days, and honestly, I loved all of it. So yesterday, Wednesday, I had my first ER shift. It was from 1 to 11. So I honestly kind of liked the setup of having a shift kind of later in the day, because I could get up, get all my stuff done, and then go to work. And I didn't really have to worry about doing anything when I came home. I just could relax for a little and then go to bed. So yeah, like I said, yesterday was 1 to 11. Today was 10 to 6, which I think I like that a little bit less. It is a 2-hour shorter shift, but I didn't have as much time in the morning to get stuff done. And by the time I got home, once after I ate dinner and stuff, like the night was kind of over. So I actually struggled a little bit more today getting all my studying in. But overall, between both of the shifts, I really enjoyed everything. Typically our shifts are a little bit more spread out. I think I just kind of lucked out that mine were back to back, so it was a lot better continuity. Like usually we can go, maybe more than a month between ER shifts, so you kind of forget a lot of like how the ER works, what you need to prioritize when working up a patient. And it can take you a little bit of time to like get back into that rhythm. But since I had them back to back, like today, I kind of just hit the ground running, and it was a much better shift than I'm used to. And honestly, I saw a lot of neuro stuff, which is kind of interesting. I mean, I don't know if it was just because I was like looking out for it more because I'm on my neuro rotation, but I mean, we kind of saw everything. We had a patient with epilepsy who came in after a seizure and hit her head, so we kind of had to make sure she was okay with that. We had a few code strokes. One was like a pretty atypical presentation where the patient only had like some left-sided face numbness. Didn't really have any focal findings in her extremities. What else? We had a few falls that, we had to evaluate for any sort of head trauma or spinal trauma. We did unfortunately have a patient who had a brain bleed. They had both a subdural hematoma and a subarachnoid hemorrhage, so that was an ICU admit. We had a patient come in for dizziness, so at first I was thinking maybe something like vertigo, but after sort of digging through the patient's history, it was probably more so something cardiac related, because it was very exertional. The patient had a history of uncontrolled hypertension, so had to get that patient to see cardiology. And then generally, just aside from the neuro stuff, I think being halfway through my rotations and having done some of the more general things like IM and surgery, I just feel very comfortable in the ER. There was this one patient where I was the first person to go see them, and as soon as I did my physical exam, I was like, this person needs a surgery consult. I mean, I just finished my surgery rotation a few months ago. Like, they had all of the signs of having something pretty bad going on in their abdomen. We kind of waited to get some imaging, but the patient ended up needing to get a surgery consult, and then they were getting emergency surgery. Yeah, I think finally I'm starting to feel like I can actually contribute to patient care. I'm able to pick up on things that a few months ago I wasn't able to. Alright, it is Friday. I just got home from clinic, so I'm officially done with my first week of my neurology rotation. And the weird thing is, I didn't actually do any neurology. Monday was my orientation. We had one lecture on neurology, and then Wednesday, Thursday were just ER shifts. And then today I was actually with a neurosurgeon. So technically not neurology either, but still, very related.
So at the beginning of this week, I didn't think I was going to be with a neurosurgeon. I thought I was going to be in a movement disorder clinic. It's my subspecialty week where you're kind of in a different subspecialty clinic every day, but mine was kind of weird because it's the first week of the rotation. Monday was Memorial Day, Tuesday was an orientation, so I lost out on 2 of the days, and then I was just going to have the 1 day in movement clinic today. But on Tuesday during the orientation, our clerkship director was like, hey, if you guys have any specific interests, if you're interested in surgery, maybe we can hook you up with a neurosurgeon for your specialty week. But unfortunately, I was already in it, so I thought it was really short notice, but I still reached out to everyone and was like, hey, if it's possible on Friday, I would love to work with a neurosurgeon. So they hooked me up with one of the head neurosurgery people at the hospital on that. So I'm really grateful for that. She was supposed to have a pretty complex brain cancer removal. Unfortunately, the patient wasn't cleared by their cardiologist for surgery, so that case was canceled. So I just spent the morning in clinic with the surgeon, and honestly, I had a great time. You know, I was on family medicine these past few months, and it was all clinic-based, but very different from the sort of clinic that a surgeon does. You know, a lot of going over imaging, coming up with plans, all that good stuff. Saw some really good pathologies. This surgeon was just a general neurosurgeon, so they saw a little bit of everything. You know, we had a patient who had this sort of pituitary cyst that was found just sort of incidentally. They were having some hearing issues, so they got a brain MRI to see if they had sort of benign tumor that was affecting their vestibular nerve that might have been causing the hearing loss. They didn't have that, but then they found this cyst, which wasn't causing him any symptoms. We asked him other questions. It wasn't having any like endocrine symptoms. So probably nothing to do about that. So that was interesting. Honestly, saw a lot of spine cases, a lot of people coming in with like radiculopathy, weakness, paresthesias down the leg, in the arms. So just reviewing that imaging, talking about the different options for surgery. I really like this doctor's approach because she wasn't really, you know, jumping to the gun for surgery for some of these patients. She was really honest with them. Some of the patients who just had pure back pain, she was trying to explain to them that, like, hey, structurally your back is completely fine, and even if it wasn't great, having, you know, a decompression or a fusion, it really isn't that great for back pain. It's more for those symptoms of like radiation down the leg or radiation down the arms. That's where, you know, the surgeries that neurosurgeons do actually help. So, you know, it was really refreshing to see her not trying to push surgery on anyone. She was just being really honest in the role that she could play and how she could actually help them. Probably the most interesting case was this patient who had a Chiari malformation. So it's basically, there's a few different types. Type 1 is usually seen a little later in life, like older children or young adults. Type 2 and 3 are more of a congenital thing, but sort of the basic idea is have sort of enlarged opening between your spine and your skull, and parts of your brain kind of move further down than they should and can actually kind of squeeze through that hole, the foramen magnum, and then it can cause problems. Usually pretty bad headaches, especially when you're doing stuff that's going to like increase your intracranial pressure. So anytime you sneeze or cough, you're going to have like this really severe headache because you're kind of squeezing parts of your brain into your brain stem. So you can imagine that would be pretty painful. So this patient for the past few months had just been experiencing like severe 10 out of 10 headaches anytime they laughed, coughed. They were like completely debilitating. They, you know, she would have to like lay down, close her eyes for a few minutes and just let it pass. And, you know, depending on if she had a cold, this could happen 10, 15 times a day. So pretty terrible, honestly. So she was worked up by a different neurologist. They got an MRI, so we reviewed it. Honestly, the MRI images weren't super concerning. She definitely had a little bit of downward movement of parts of her brain, but it didn't look like they were compressed against anything. But her symptoms were so classic that, you know, it was something that we talked about surgery for, went through all the steps of the procedure, what recovery would look like. You know, she has a family, she has 3 kids, so she had to think about what surgery would entail. It really has to do a lot of sort of the pro-con analysis between how her quality of life is with this condition right now, and if she'll be able to go through the surgery and the recovery process, and basically if it would be worth the risk. So she didn't agree to surgery today, but she's gonna think about it. All in all, I really enjoyed the day. Probably the highlight of the day was I was able to adjust a patient's VP shunt. So this patient had normal pressure hydrocephalus, which is basically too much CSF in their brain. Causes a lot of issues. The classic triad is called wacky, wobbly, and wet. So wacky is dementia, wobbly is sort of imbalance or ataxia, gait disturbances, that kind of stuff, and then wet is incontinence. So the patient had all those classic symptoms, so put in a VP shunt. Honestly, really helped. All of her symptoms pretty much went away. She was wheelchair bound, but then she got better. Unfortunately, she had a fall and then developed a subdural hematoma, which apparently isn't really compatible with a VP shunt. The way that the shunt works, it kind of prevents the subdural hematoma from resolving. So we essentially had to increase the resistance so much that it wasn't actually draining anymore, and then let the subdural kind of dissipate. It got better, so now it's time to reverse what we did the VP shunt. So I was actually able to sort of decrease the resistance. It was really cool how it works. You find the shunt on the patient's skull. I guess I didn't really explain what a VP shunt is. So it's basically a tube that goes from one of the ventricles in the brain and then is sort of threaded or tunneled under the skin and then put into the patient's abdominal cavity to allow it to drain. And it's like a pressure valve on it, so if the pressure in the brain gets to a certain level, it'll open and drain the excess fluid. So I was able to, with a magnet, actually turn the resistance from a higher amount to a lower amount to make it easier for that drainage to happen. So that was pretty cool. I didn't know that that's how it worked. I kind of assumed nowadays it's some app on your phone or something, but I guess you probably wouldn't want that. But yeah, it's interesting. It's literally just a magnet that you use to turn, and then you turn a magnet that's inside of the shunt itself, and that's how you adjust the pressure. So that was pretty cool. That was the last patient of the day. All in all, I really enjoyed my day. Got to see a lot of different things. I think general neurosurgery is so cool because you can do so many different operations. I mean, I didn't even think that a neurosurgeon did carpal tunnels, but she was saying how so many patients would come to her misdiagnosed. They would come, from wherever they're PCP or neurologist with, suspected cervical spine disease. And once she actually did the questioning, it's no, you just have carpal tunnel. So instead of sending them to another hand person, she's like, you know what? This is a simple enough procedure that I could probably just do it myself. So, yeah, I mean, all in all, pretty cool. I think during my 4th year, I will probably do some sort of neurosurgery elective. I don't think I want to go into the field, but I do find it really interesting and definitely want to learn more about it. All right, well, that is going to do it for today's video. If you enjoyed, please be sure to leave a like below and subscribe if you want to see videos like this in the future. Thanks, and I'll see you in the next one.